This is a presentation of a person with a very complex pain syndrome, which includes pelvic floor dysfunction. And her pelvis is extremely rigid. I'm trying to do a standard spring test, and it feels like I'm pushing on this thick mass of wood. It's just not yielding at all. And it doesn't matter which direction I try to move it in. Going side to side, hardly any motion at all. Going inferiorly. Now in contrast, if I spring her rib cage, I can load her rib and I can spring that. I can come laterally off the cartilage and on the bone. I can load that and I can spring that. I can take her wrist and glide it up. Now I don't know if the camera can see that movement, but I see distinct movement, and then I can give it a little bit of spring, and there's a little bit of yield there that's natural. It's not natural for someone's pelvis to present like a block of wood, okay? She has excellent hip mobility. Okay, let's have you lie on your stomach, please.
You want this out, Jerry?
Sure thing. Go ahead and put your face in the opening there. The PSIS is right here, and the sacrum is right here. The sacrum is posterior in relationship to the PSIS. Here's her right PSIS, and here's her sacrum. I don't know if the camera angle can capture that or not, but her sacrum is prominent. When I attempt to spring the sacrum, there's no give, and I'm applying more than 15 pounds of force. I can't get any anterior rotation through the hemipelvis. I can't get any inferior glide mobility. Now perhaps if I pushed with 75 pounds, perhaps so, but an average female with your body type should have mobility with just 15 pounds of force. The sacrotuberous ligament is extremely tight and it feels superficial. It feels like bone. It's supposed to have a little bit of yield, okay? Now, in response to this pattern, we have seen that there's a reflex effect in which the upper cervical spine loses mobility as well. Let's have you lie on your back again, please. All right, so I have a little bit of your head and neck showing, and I'm trying to keep your eye out, your face out, out of the camera. Good. Okay. When I attempt to traction your neck, it's extremely rigid. I should be able to create mobility through your body by simply putting about 10 pounds, no more than 15 pounds of traction, and that's just not happening. I should see your feet move up and down. Again, it feels like I'm pulling on a long tree stump, very rigid. When I put my hand on the mastoid process below the ear, that's extremely rigid. I can't spring it towards the floor, which would induce rotation. When I come underneath the mastoid, I can't induce side bending. And when I come underneath that on the transverse process of C1 and I try and glide it to the right, there's no mobility there. I could force it, but using a reasonable amount of effort, it's not moving. When I come down to C2, look how freely the mobility happens. It's very easy to translate your head and neck to the right. When I come up to C1 using the same amount of force, no such thing. So we have a very rigid pelvis and a very rigid upper cervical spine. We also have considerable rigidity in the shoulders and the acromioclavicular joint on both sides. Your pain syndrome is very complex, and it's a whole body phenomenon. And I'm not going to belabor the medical history. I want to focus mostly on showing the most rigid parts of your body And other than these areas, your body is quite flexible. We demonstrated on your wrist, good mobility of the wrist bones, good mobility of the rib cage, feet and ankles, knees, hips move very well. But the pelvis is like a block of granite, and reflexively you are very rigid in the upper cervical spine, in the OA joint, and in the AC joints. So I'm going to stop filming now, and we'll treat you, and we will film after treatment to demonstrate any changes that we make.
Thanks, Jerry.
Thank you for letting me film you.